Okay, hey everyone. So my project is on muscular dystrophy. So we are going to get started. It lets me. All right, here we go. So what is it? So it is a collective group of inherited non-inflammatory but progressive muscular disorders. However, it doesn't interfere with the central or peripheral nerve abnormalities. So the word kind of comes from two things. So dys, which means difficult or faulty, and troph is nourish. So muscular dystrophy kind of works together. So it was discovered in 1830 by Sir Charles Bell. So it's been around for quite some time. He actually wrote an essay specifically with boys to kind of figure out what's causing this progressive weakness in boys. So 6 years later, so in 1836, there was another scientist that reported two brothers who developed generalized weakness, muscle damage, replacement of damaged muscle tissue with fat and connective tissue. And with these symptoms, they were kind of confused. They kind of thought that a lot of these symptoms were really relevant to tuberculosis. So back then, a lot of these boys that actually had muscular dystrophy had leg diagnoses due to the fact that they thought it was tuberculosis. The most common muscular dystrophy is Duchenne MD, which is in fact, it was first reported by Gaetano Conte in 1836. It's still today, it's a really relevant, really popular, kind of the most common muscular dystrophy. It's also considered the most severe one, which we will get into a little bit later. But next, we're going to go to etiologies. So MD can be inherited in three different ways. So if you think back to biology 30, the autosomal dominant, autosomal recessive, and the X-linked. These are kind of the ways that a lot of youth kind of get muscular dystrophy. So as a little review, we'll go through them. So autosomal dominant. So it's when the child receives a normal gene from one parent, but a defective gene from the other parent. Autosomal recessive is inheritance, means that both parents must carry and pass on the faulty gene. The parents each have one defective gene, but are not affected by the disorder. And then lastly, X-linked. So it's a recessive inheritance occurs when a mother carries the affected gene on one of her two X chromosomes and then is passed down to a son who also inherited the X chromosome from their mother, and then the Y chromosome from their father, and daughters inherit an X chromosome from each parent. So if you think back from Bio 30, that's kind of how it works. So what is it actually? So muscular dystrophy, so it generally will run in a family. It usually develops after inheriting a faulty gene from one or both parents. MD is caused by mutations in the genes that are responsible for healthy muscle structure and function. The mutations mean that the changes that should maintain your muscles can no longer fulfill the role, which leads to muscle weakness and progressive disability. So if the parents carry an altered version of the gene, that causes the condition, and it's generally a 1 in 4 chance of their child being diagnosed with muscular dystrophy. So now we're going to go in a little bit deeper. So the most common Duchenne's. This is just kind of the research that I found on Duchenne's. Every other muscular dystrophy is kind of formed very, very much the same with the lack of dystrophin. So like it says here, so it's caused by a mutation in the gene that encodes for dystrophin, which is a structural protein found in small amounts of normal muscle, but in Duchenne, it's absent. So since this dystrophin is missing, muscle cells are damaged. So the muscle weakness leads to these issues, particularly in the heart, lungs, and young men with Duchenne generally only live to their mid-20s, which is really unfortunate. Again, the Duchenne's muscular dystrophy only affects younger boys. So as the picture on the side there, a little bit of facts. So 300,000 children are diagnosed worldwide, 15,000 in the US. And then 5 of those Duchenne's are usually diagnosed before the age of 5. So Luckily, with the large amount of research that they've done over time, they've been able to diagnose it a little bit easier compared to when we discussed about Sir Charles Bell in 1830s. You know, they were very much similar to tuberculosis symptoms, but now with the research, they are able to diagnose it a lot earlier. And pathophysiology. So muscular dystrophy is a disruption of dystrophin or the sarcoglycans. So sarcoglycans are proteins responsible for connecting muscle fibers to the cytoskeletal area to extracellular matrix to prevent damage to the muscle fibers. With dystrophin proteins, this leads, so the lack of leads to muscular dystrophy. So dystrophin is a complex filled with myofibers and concentrated into the costomeres, which are rib-like structures in the plasma membrane. However, in the absence of dystrophin, the plasma membrane can become fragile and can lead to exposing the dystrophin deficit muscles, which can lead to blebbing. So blebbing is a bulge of plasma membrane of a cell. So lastly, so with MD, there's a loss of myofibers, which occurs usually by necrotic cell death. So the picture there, you can just kind of tell the difference in what it looks like when there's a lack of dystrophin with MD compared to normal muscles. Signs and symptoms. So these are just going to be very, very general. The next slide goes into a lot more depth. So general, so they're going to have troubles running, jumping, sitting, standing. A lot of them are going to complain of pain and stiffness in the muscles. As the disease progresses, since it is a progressive disease, they are going to, have harder times walking. Cardiac muscles become weaker, which can also lead to a lot of cardiac issues. A lot of them have breathing problems, and a lot of them experience dysphagia. Complications can occur, so scoliosis, shortening of muscles, and cardiac issues. So quickly, so the biggest thing is muscular dystrophy. There are tons, there's over 30 of forms of muscular dystrophy. However, I'm just gonna kind of touch on 9 of them. These 9 that are posted are the most common ones that we see. So myotonic, most common in adults. Duchenne's, like I mentioned before, it's the most common in children, and it's the most severe. We got Becker's. It's kind of similar to Duchenne's, it's just a little less severe. Limb girdle affects men and women. The facioscapulohumeral, 50% live a normal life and can walk. Congenital, so obviously at birth. So there are 2 forms, the Fukuyama and the congenital muscular dystrophy with myosin deficiency. We have the oculopharyngeal, so affects men and women. Distal, it's rare, but it also affects men and women. And Emery-Dreifuss, it's a rare case that women can be affected. So as you can kind of notice the pattern with all the muscular dystrophies, men are generally more commonly affected compared to women. So I thought that was quite interesting to look at. And then we have this huge list. I'm not going to go through it all. You guys are welcome to continue going through them. I'm just going to kind of touch on kind of the more popular or most common ones. So looking at Duchenne, so age of onset's usually 2 to 6 years old. They're experiencing general weakness that affects the pelvis, upper arms, eventually all voluntary muscles. Again, like I said, it only affects boys, and the survival rate is usually about 20 years old. A lot of these patients will be found in wheelchairs. And let's go to distal. So distal hits 40 to 60-year-olds. Weakness, wasting of muscles, hands, arms, and lower legs. Again, it is a slow progression. A lot of these different muscular dystrophies are slowly progressed. However, with the facioscapulohumeral, which the onset is child to early adult, I thought this was interesting. So it affects the facial muscles, shoulders, and upper arm weakness. It is a progressive disease that generally starts off slow, but then the patient's going to rapidly deteriorate. This lifespan They generally onset, they generally will survive a couple of decades after their onset. Myotonic, so 20 to 40-year-olds are being affected by this MD. So weakness of all muscle groups accompanied by delayed relaxation of the muscles after contraction. Myotonic generally affects the face, feet, hands, and the neck first. And the lifespan is usually around 50 to 60 years old. Those are all the ones I'm going to touch on, but I would, if you guys are interested in continuing learning about muscular dystrophy, I would definitely continue looking into it. It was really interesting to look at. So there's the signs and symptoms. Now we're going to move on to treatments. So there's a couple of treatments. Unfortunately, they have not found a cure for muscular dystrophy. So these are just kind of helping to kind of keep them comfortable and try to live as normally as possible. So first things first, so the steroids. So corticosteroids, most common is prednisone, which we all know about. And then they also use deflazacort. So these are kind of the standard care for MDs. They help improve muscle strengthening, breathing, and decrease weakness. However, patients who use steroids for a long period of time, they are at risk of brittle bones. So again, that's going to be that contraindication of it over time. Also, they're on medicines that target gene mutations. So eteplirsen and coladirsen, which increase levels of gene dystrophin. So again, dystrophin is a protein found in skeletal muscles, which suffers from muscular dystrophy. They are also on anticonvulsants, which I thought were really interesting. So the anti-seizure medications will also reduce any muscle spasms. And immunopressants, so they're on these to help prevent some of the muscle cell damage. And lastly, some antibiotics. So a lot of physicians will prescribe antibiotics to treat any lung infections, which is common in people with muscular dystrophy. So I thought that was really interesting because a lot of them can also contract aspirated pneumonia due to the muscle loss. And fun. So we have test questions. Okay, so which of these is not a form of muscular dystrophy? A, Duchenne, B, facioscapulohumeral dystrophy, C, lunar dystrophy, or D, myotonic dystrophy? Which of the following muscle groups are the main ones affected by MD? Legs, B, it varies by the type of MD, C, arms, or D, torso? Question 3, there's a cure for MD. A, true, B, false. Question 4, how many different forms of MD are there? 9, 15, 30, or 11? And MD is an inherited disease, true or false? So I'm just going to give you a few moments to get your brain working to get through these test questions. All right, let's go to the answers. So lunar dystrophy is not a form of muscular dystrophy. Cool name, but that is not a form. B, it varies by the type of MD. So as I kind of mentioned, there are 9 really common MDs. They can, the legs, face, arms, upper legs, lower legs, it's very variant. Cure, unfortunately, there is no cure, but I know that they, like a lot of foundations, are trying to find a cure. And how many different forms of MD are there? So the answer is 30. So there is over 30 muscular dystrophy diseases out there. And MD is an inherited disease. That is true. So like I mentioned before, generally this inherited disease runs in the family due to autosomal recessive, autosomal dominant, or X-linked genes that come from the parent. So if they contract a faulty gene from parent A or parent B, they have a 1 in 4 chance of getting muscular dystrophy. And lastly, I have my references, and that is everything. I hope you guys have more enhanced knowledge on muscular dystrophy. And thanks for watching, friends. Bye.